Nocturnal Enuresis. Objectives: identify nocturnal enuresis, explain types of a nocturnal enuresis, list cause of a nocturnal enuresis, list solutions about a nocturnal enuresis.
What is the meaning of nocturnal enuresis? Physicians emphasize that bedwetting is a symptom, not a disease. Bedwetting is not a mental problem, or learning problem, or behavior problem. Even children with no history of bedwetting may lose bladder control from time to time. Bedwetting may appear or increase when a child is ill. What is the meaning of nocturnal enuresis? Physicians emphasize that bedwetting is a symptom, not a disease. Bedwetting is not a mental problem, or learning problem, or behavior problem. Even children with no history of bedwetting may lose bladder control from time to time. Bedwetting may appear or increase when a child is ill.
All of the causes of bedwetting are not known. Physicians emphasize the bedwetting as a symptom, not a disease. Bedwetting is not a mental problem, learning problem, or behavioral problem. Even children with no history of bedwetting may be lost bladder control from time to time. Bedwetting may be appear or increases when a child ill. Although the reasons of bedwetting may be vary from child to child, there are some common reasons why a child might wet the bed. Bladder size, kidney or bladder problem are rarely the cause of bedwetting in older children after age 3 to 4. However, it appears that some children who wet the bed have relatively small bladder that cannot hold much urine. Neurologic issue. Some children maybe have nervous system that are not sufficiently developed to get the right signal between bladder and brain. For these children, it's just matter of time until the brain develop enough to solve the problem. Genetic and family factors. Bedwetting appear to run in family. Approximately 75% of children with bedwetting problem have a parent or sibling who has had a similar problem. In addition, the approach present take toward toilet training their children can cause bedwetting. Hormones. Recurrent research suggests that some children who wet the bed may be lack sufficient level of important hormone. Psychological cause. Sometimes bedwetting can be a response to stress, such as emotional conflict or anxiety. The child is experiencing psychological and other mental health professionals regularly report that children begin wetting the bed during time of conflict at home or school. A dramatic change in home and family life also appear to lead some children to wet the bed, moving to a new town, parent conflict or disavow, arrival of a new baby, or loss of a loved one or pet can cause increasingly to contributing the bedwetting. Often children are not even aware for either emotional and cannot believe that there is link between their feeling and bedwetting.
What should you do? See a doctor. If your child is aged 6 or over and continues to wet the bed frequently, it is probably time to talk to his or her pediatrician. If your child has never been able to establish bladder control for 3 to 6 months, there may be a medical cause to his or her problem. Example, tumors, undiagnosed infection, etc. If your child is aged 3 to 5 and has recently started to wet the bed after several months of dryness, you may also wish to consult your pediatrician. The rule of thumb is don't make bedwetting a problem, but if it is become problem, don't hesitate to take action. Start by seeing a doctor to rule out a medical problem.
Now, we will talk about the treatment and solutions for nocturnal enuresis. First, exercise and bladder training through delaying the urination a few minutes after the first sensation that the bladder is full, to stretch the bladder and stopping the urine flow midstream to strengthen bladder muscles. 2. Psychotherapy can be effective treatment for children's wetting problems if their wetting appears to be a reaction to family changes like birth a new baby, stressful situations like school problems, or an emotional or traumatic events like divorce. 3. Give your child a half cup of fresh cranberry juice to stop bedwetting. And 4. Be aware that your child is happy because most of children who have nocturnal enuresis lose his confidence and feel embarrassing all the time. Five, massage the pelvis and bladder by using heated olive oil and rub it over your child's lower abdomen gently for several minutes to increase the capacity of the bladder. 6. Avoid giving the kids chocolate or junk food or soda in the evening and limiting the fluids, especially water, during the evening. 7. Cinnamon is a good choice to stop bedwetting by chewing a piece of cinnamon stick once daily. 8. Schedule waking. Set up a routine of asking the child to pass urine before going to bed and then waking him or her up when she sleep or he sleep 2 to 3 hours and taking him to the toilet. Nine. Reward every time the child has dry night. 10. Urinary bed alarms are the most effective bedwetting treatment for the long term. 11. Anytime the child is dry in the morning, feel them how great they are, congratulate them, and tell them you are getting to be a big boy or girl. 12. Don't use punishment with kids who experience nocturnal enuresis through reprimanding or abuse or hitting them because this leads to complicated the problem.
Which strategy should we use? Choosing the best treatment for your child's wetting problem depends on a variety of personal and lifestyle factors. Research generally supports the use of moisture alarms as the best approach for curing bedwetting in the long term. This approach also eliminates the risk of side effects from medication and is generally the most cost-effective strategy. Using moisture alarm in combination with psychotherapy may be the best option if children are having behavioral or emotional problem along with their wetting problem. However, some families prefer the convenience of medication and their ability to reduce bedwetting relatively quickly if they are effective. Such decisions should be made with the guidance of physician and or mental health professionals specializing in the treatment of children and aware of all treatment options available. Be wary of professionals who recommended only the treatment they can offer without discussing alternatives. Our teaching session lasts 30 minutes and we achieved 5 objectives. And there are, following a 30 minutes teaching session, the mothers will be able to 1. Describe the definition of nocturnal enuresis with 100% obvious meaning. 2. Distinguish between two types of nocturnal enuresis with full understanding of these types. 3. Summarize the cause of nocturnal enuresis, at least 3 causes comprehensively. 4. Choose the suitable solution for deal with her son or daughter who experience this problem. And last one, express any concern regarding self-dealing with her son or daughter who experience nocturnal enuresis. I am Hadil Jihad with my colleagues Taqwa Al-Mashayikh, Wa'ad Ibrahim and Lara Hassan from the School of Nursing in the University of Jordan. We apply teaching session for the student's mother in Al Jandawil School about nocturnal enuresis. We evaluate the teaching process through post-test by using numbers and cards. The result was positive, and there are some of the mother answer about our question.